Hi, good afternoon. My name is Nicola Campbell, and today I'll be presenting a short feature on cardiovascular pharmacology with a focus on beta blockers. Now, the time will not permit me to go into details, so I'm just going to try to go over the basics enough to give you a better idea of what a beta blocker is, the mechanism of action, and how they help to improve the overall health of individuals who have been prescribed this medication. A beta blocker essentially is a drug that binds to what is referred to a beta adrenoceptor. And by doing this, it blocks the binding of norepinephrine or epinephrine to these receptors. This process inhibits the normal sympathetic effects that act through these receptors. Hence, beta blockers are or can be classified as sympatholytic drugs, and excuse my pronunciation. Some beta blockers, as they bind to beta adrenoceptors, will partially activate the receptor, preventing norepinephrine from binding to the receptor. Hence, some beta blockers possess what is referred to as a membrane stabilizing activity, MSA. And essentially what happens is that this effect is like the membrane stabilizing activity of sodium channel blockers. Now, I should state before that there are different types of receptors or classes of drugs that function similarly to beta blockers. There is the calcium channel blocker, and as I just mentioned, there is the sodium channel blocker. Beta blockers bind to beta adrenoceptors, and these are located in the cardiac nodal tissue, which is the conducting system and contracting myocytes. The heart has both beta 1 and beta 2 adrenoceptors, although the predominant receptor type in numbers and function is the beta 1 blocker. So beta blockers are used to treat different conditions. Typically, they're used to treat hypertension, myocardial infarction, which is your heart attacks, angina, tachycardia, and other side effects resulting from other illnesses, which would include one of those that I just mentioned. For example, a few years ago, I was diagnosed with hyperthyroidism. And one of the symptoms of hyperthyroidism was tachycardia. So I was put on propranolol to regulate my heartbeat. And having said that, beta blockers decrease arterial blood pressures, or blood pressure, my apology, by reducing cardiac output. Many forms of hypertension are associated with an increase in blood volume and cardiac output. Therefore, by reducing this cardiac output by beta, what is referred to as beta blockade, we can it results in an effective treatment for hypertension, especially when used in conjunction with a diuretic such as furosemide or spironolactone. I mentioned angina and myocardial infarction. The anti-anginal effect of beta blockers are as a result of their cardiodepressant and hypotensive actions. So by reducing heart rate, your pulse, contractility, and arterial pressure, beta blockers reduces the work of the heart and the oxygen demand of the heart. And so by reducing this oxygen demand, we are improving the oxygen supply and the demand ratio, which will essentially relieve a patient of anginal pain that is caused by this reduction in oxygen supply and demand due to coronary artery disease. Now, normally I would stop to ask questions and to clarify any misunderstandings and to test for master and grasping of the concepts. But since this is in the form of a webinar, we will assume that at the end of the presentations, questions would be presented to the presenter by the students or the listeners. There are different classes of beta blockers and there are specific drugs. Uh, Beta blockers that are used clinically can be divided into two main classes. These are your selective beta blockers and your relative selective beta blockers. Some beta blockers have what we refer to as additional mechanisms besides beta blockade, and these contribute to their unique pharmacological profile. There are some side effects to beta blockers. As I mentioned before, I myself was on a beta blocker, and I find that one of the side effects was dizziness. It reduces your heart rate, it reduces your pulse, and by doing that, there is a potential of which results in hypotension, which results in the possibility of some dizziness being experienced. Many of the side effects of these beta blockers are related to the cardiac mechanisms and include, as I mentioned, bradycardia and hypotension. So beta blockers can also mask the tachycardia symptoms that serves to warn for hypoglycemia in diabetic patients. So a patient who is diabetic and is experiencing hypoglycemia or is in this patient would typically, a typical sign would be tachycardia. But if this patient is on a beta blocker, this beta blocker is going to mask that symptom. And so that patient might be at a risk, and hence a beta blocker needs to be used cautiously in diabetics because it stands to mask other symptoms. There are many beta blockers on the market today that are prescribed. Common examples include propranolol, metoprolol, atenolol, labetalol, and carvedilol. This was really a quick presentation. Had we more time, we would go into more details. But essentially, beta blockers serve to reduce cardiac output, thereby increasing the oxygen supply, reducing oxygen demand to the heart. It helps in reducing or addressing tachycardia, but should be used cautiously in patients who are diabetic, as tachycardia can be a symptom of other underlying issues. So again, thank you very much for your time today. I appreciate the consideration being given and hope to hear from you soon.